అంటే కాపీ పేస్ట్ చేయొద్దా?
ఒరిజినల్ ఫైల్ ఇట్లా చేసేసి సిస్టంలో కాపీ పేస్ట్ కొట్టాలి. మీరు సెంట్ కొట్టాలి. సెంట్
ఒరిజినల్ ఫైల్ ఏం చేయాలి?
చూపిస్తాను. అయిపోయినాక చూపిస్తాను. ఆల్రెడీ స్టార్ట్ చేశాను.
పర్లేదు, పెట్టు, మాట్లాడు. అవునా, సెండ్ టు అని కొట్టొద్దా?
సెంట్ కొట్టాలి.
ఏం కొట్టాలి?
కాపీ పేస్ట్.
కాపీ పేస్ట్ చేయాలి.
సిస్టంలో ఫైల్ ఇంటూ కొట్టేసారు. స్టార్ట్ అయింది. చెప్పండి.
అంతేనా? Okay, today's class is iron deficiency anemia. See, iron deficiency anemia is a very common question that is asked in the examination. The iron deficiency anemia usually occurs in people who are nutritionally deficient one, or people who eat less and who are in high demand, like pregnancy, which needs more iron, and adolescence, which needs more iron, or any other hypercatabolic states where you need more iron for metabolism, and one more condition where there are defects in the iron carrying enzymes which are responsible for the erythropoiesis. And when you say anemia, we call anemia because of deficiency of hemoglobin less than 13 grams per deciliter in men, and 12 grams less than 12 or 11 grams in women. We call it as anemia. In anemia, usually they have deficiency of hemoglobin in the blood, and deficiency of iron circulating in the blood, usually have iron deficiency anemia. If you take the blood picture of iron deficiency anemia, the packed cell volume is reduced to less than 45 volumes. Normally it is around 45 plus, depending upon HB. And then the cell morphology of anemia, if you take this peripheral smear, you find a peripheral smear, you find the difference between the cell size. There is variability of the cell size at the same time, and the size is variable and shape is also variable. That is called poikilocytosis, and you may find pencil cells, etc. This is, and pale vacuoles may be present in the RBCs. This is how you make a diagnosis of iron deficiency anemia. And the ferric and ferrous levels in the blood will be less in iron deficiency anemia, as well as in this is how you make a diagnosis of iron deficiency anemia. Then the epidemiology. So it is found mostly in all the developing countries, South Africa, Nigeria, or Somalia, India, Bangladesh. Many a times, they all developing countries can have iron deficiency anemia with history of nutritionally deficient, social, poor socio-economic status of the individuals, multi-para of the women, and many children with low income group, people who do not eat nutritious balanced diet, which is not affordable to the individuals, and those are the people naturally have with bad hygiene and parasitic infestations like hookworm infections, Ascariasis, staphylococcus infections, many infections, amoebiasis, chronic amoebiasis. So all these infections can produce loss of blood from the gastrointestinal tract, or in old age with a gastrointestinal malignancy and loss of blood from the gastrointestinal tract. This is about the epidemiology. The signs and symptoms, usually the patient with the symptoms. The symptoms, what they have, many a times, many of them may not have any symptoms, asymptomatic, and some of them will have symptoms. They are symptomatic. Commonest symptoms of anemia or easy fatigability because of less RBC, which cannot be in a position to take up enough oxygen in the lungs and come out of the lungs and go into the systemic circulation and supply at tissue level. It's not possible with less RBC, less hemoglobin. It's not possible. That's why they have fatigue and shortness of breath because the same amount of RBCs. So normally one should have 5 million per cubic millimeter. If they have 2 million cubic millimeter, they have to circulate double the time, sometimes triple the time, without carrying much oxygen to the peripheral tissues. That is the reason they have tissue fatigability. Whole body gets fatigued. Shortness of breath because of excessive heart function. Because same RBC should be circulated, sent back to the tissues. Heart functions faster, produces a palpitation. Because of hypoxia, they may have easy fatigability, shortness of breath, palpitation, and hypoxia may lead to cerebral anoxia, leads to headache, and sometimes they may throw a fit. So these are all the usual clinical symptoms what patient has. The shortness of breath usually may vary from the basing on the degree of hemoglobin in the blood. More severe anemia, the patient even may go into heart failure You may develop even heart murmurs and may develop third heart sound as a sign of heart failure. These are the symptoms. The signs usually patient will have alopecia because they have associated vitamin B and A deficiency. They have loss of hair. That's one. Second is pallor of the conjunctiva, pallor of the tongue, and pallor of the tongue is also possible. And then you have pallor of the nails. If it is a chronic iron deficiency anemia of long standing time, you may find spooning of the nails. It's called koilonychia, and sometimes you may find a smooth ball tongue because of deficiency of B2 and other B complex deficiency like pantothenic acid, niacin, etc. And if you auscultate over the heart, you will find a hemic murmur. The patient is going to incipient or true heart failure. You may find a third heart sound. Then these are all the signs, and sometimes even phrenoderma may be present due to deficiency of vitamin C and A. Vitamins can produce phrenoderma, rough, thorny skin. These are all the signs. And the symptoms, the signs you have palpitation and tachycardia and heart murmurs, systolic murmur in the heart, third heart sound as a sign of heart failure, and edema of the feet because of decreased oncotic pressure in the circulating blood because of deficient protein can also lead to edema. Edema can be also due to heart failure or it may be due to in combination. So that is also one. And they may have bilateral pleural effusion, pericardial effusion, puffiness of the face. These are all the signs which suggest the iron deficiency anemia. These are all the signs and symptoms. Then, how to treat the patient? Once you and if you check the blood pressure also, usually blood pressure will be low in anemia patients, hypotension, and of course, in a patient with other systemic disorders, they may have hypertension and anemia, as you note in a chronic kidney disease. You may have hypertension and anemia also may be present. So the audio and your on physical examination, how do you treat the patient with anemia? You have to treat the patient with anemia. Usually, anemia, and you have to get all the investigations. The ferritin level estimation is the gold standard. Bone marrow aspiration and ferritin levels or serum ferritin levels. If they are so less than the normal, that is the gold standard to make a diagnosis of iron deficiency anemia. The risk factors which will facilitate to develop an anemia that we have discussed, that is enzyme defects. The iron carrying enzyme defects which help in the erythropoiesis is one cause. Increased demands, less intake is another cause. Deficient food intake is another cause. These are all the risk factors. Or ferritin deficiency will be presented when you start erythropoietin, because erythropoietin, which help in the synthesis of blood, that is hemopoiesis, which utilizes the iron stores in the uh, from the body. That is the reason uh, they have serum ferritin less in people who are taking erythropoietin. So these are all the risk factors which will facilitate or infection, parasitic infections, blood loss due to menstruation, blood loss through the gastrointestinal tract, maybe due to malignancy, occult blood, or APD and acid peptic disease. So these are all the risk factors. The factors which will enhance the iron absorption. The factors which enhance the iron absorption, when you take this iron tablets along with red meat, usually it increases iron absorption. Red meat also will have iron, and both put together the absorption will increase and the serum ferritin will increase. Or when you give iron along with the vitamin C, it will increase the absorption because it reduces the ferric to ferrous, and which is easy to absorb from the gut. The absorption usually is maximum in the jejunum and duodenum and the upper jejunum. Lower down is not much, and these things will increase. And high fiber diet will decrease the iron absorption. The fiber will intervene between the absorption of iron from the gut. That is also one factor. Of course, high fiber diet is advised for lifestyle modification to maintain the ideal body weight, to reduce the weight. But sometimes, and high iron containing diets should be given to the individual, like bananas, avocados is a fruit. These are all the fruit, berries, cranberries, etc. Or when, or pulses which will have high iron content, or red meat, poultry, or fish, eggs can be given, but they have less uh, content of iron. But non-vegetarian diet, organ meat will have more iron, and pulses can be given to those individuals. So this is how, and then you have how to treat the patient with, the epidemiology, the absorption of iron and iron metabolism, which is very essential in treating a patient. And one thing is, so whenever you make a diagnosis of iron deficiency anemia, never forget to diagnose what is exactly the reason for the anemia in this patient, and then start treatment. You have to investigate. The blood samples should be done, and PCV should be evaluated. Serum iron therapy, serum iron estimation, serum ferritin estimation, stools for ova and cyst for any occult blood, upper end GI endoscopy for any upper GI malignancy or peptic ulcer disease, or lower GI endoscopy to rule out any colonic carcinoma or any ulcerative colitis or any inflammatory bowel disorders. If you doubt, where patients who pass blood in the stools like Crohn's disease, ulcerative colitis, or diverticulitis, etc., etc., or tropical sprue. Also, they have a defect in absorption of iron because they have lot of defects uh, in the brush border of the intestines. There they cannot digest and absorb the fats and fat soluble vitamins and even iron also, and all other vitamins also. And such people will even have fatty stools, bloating of the abdomen, loss of weight, and all the signs and symptoms that we have already discussed, like skin changes, pallor, dusky skin, loss of luster in the face, all the complications, all the vitamin deficiency, even vitamin A deficiency in the eyes, in the form of bitter spots that you can see, or carry when they may go into keratomalaysia, one should keep it, or phrenoderma, etc. One should keep it in mind in those individuals. The treatment. Once you make a diagnosis, and even the red cell distribution width also will be increased in anemia, and the size of the iron deficiency anemia cells will be small, and some are big or sometimes variable, that we have already discussed, but the color is lesser. Hypochromic microcytics, cell size also comes down. Hypochromic microcytic poikilocytosis, that changes of the sizes of the RBCs, are the characteristic of iron deficiency anemia. Once you make a diagnosis, how do you treat? Then you treat the anemia. So suppose you treat many a times with oral iron is the best way of treating the patient with ferrous sulphate or ferrous fumarate, ferrous gluconate. These are the tablets which are available. Will have 365 milligrams, which gives you 65 milligrams of elemental iron to the patient, and should be given 3 times a day, and best way of giving is with empty stomach. And if you give with vitamin C, absorption is more, or red meat, absorption is more, but usually many may not practice. If you give it, it's better, absorption is better, clinical response will be better. And next is these tablets can be given orally. So after starting oral therapy, at least after a week or 10 days, usually the action of the iron will start. This how to know? Then you send the blood for a reticulocyte count. Usually, reticulocyte count, the basal reticulocyte, the count that you have done just starting of the therapy, and see the difference after starting of the therapy. After 1 week or 10 days, there will be hike or not. If there is a hike in the reticulocyte count, it is definitely uh, the iron that you are giving is working. That's a good response, and they will have increase in the um, HB slowly, and you should be given at least 2 to 3 months of time to increase the HB levels, and patient starts feeling better. Along with that, you can give B complex, B12, etc. If they have concurrent deficiency, that can be corrected. And good nutrition is of great value in treating a patient of iron deficiency and anemia. Or all greeny leaves can be supplemented like spinach, kale, etc., etc. So they have a lot of iron in them. They should be given to those individuals. Okay. And next is all red meat, organ meat, fish, poultry, eggs, all can be given. Milk also can be given, but it will have less iron. Okay, so that's orally you can give. The side effects of ferrous sulfate or all drugs are the same. Suppose if they have side effects, and non-enteric coated tablets are more preferred over enteric coated tablet, because enteric coated tablets usually will have less absorption than non-enteric coated tablets. One should remember. Some people may have abdominal colic and bloating in the abdomen. They may cause even black stools, which suggests that your patient is compliant and taking sincerely the tablets orally. And it's not a side effect, but usually iron stains the stools black in color. That's one. Next is some of them may have rash over the body and nausea, vomiting, abdominal colic. If they have any gastric distress and intolerability, and you can go for a parenteral therapy of iron. The parenteral iron therapy can be given in the form of iron sucrose, iron dextrone, Hmm? And iron sucrose, iron dextrone, and can be given by mixing in 5% dextrose. So starting you can give 1 or 2 ml straight away intravenously to see whether the patient will develop any anaphylactic shock. Suppose the patient develops any adverse reactions, nausea, vomiting, and hypotension, anaphylaxis, and try to give only orally, slowly, uh, iron therapy to those people who are prone to develop anaphylaxis iron. Okay, so this is how you should treat the patient with iron therapy, and monitoring by doing a reticulocyte count, and at the same time, and you should give the iron therapy till the ferritin level C in the blood comes to 50 nanograms per deciliter. Once it comes to 50, then you can withhold the iron therapy. That one must monitor. And many patients, of course, in our country are non-compliant, or the investigations are more costlier than the treatment. They may or may not afford. But we should remember that we should do uh, ferritin levels 50 nanograms per deciliter. So, having given this treatment, suppose the patient comes to your casualty with the signs and symptoms of heart failure. If a patient is having any hemodynamic disturbance like going on to heart failure, developing a hypoxia of the brain and convulsions, you may have to give immediate, or patient is having postural hypotension, postural drop of systolic blood pressure more than 20 millimeters of mercury. These are the conditions. Or pregnancy with heart failure, you have to transfuse packed cells, at least 1 to 2 units as an emergency, to raise the HB in these individuals, to decrease cerebral anaxia, and to prevent convulsions due to hypoxia. May have to even supplement oxygen also to these individuals. There you need to give intravenous blood supplements. In heart failure, if hemoglobin is very less, you give only packed cells because patient will have more volume. So in the blood, because plasma volume is more in those individuals. If it expands, it may aggravate the heart failure. That's why you have to give intravenous Lasix and blood mm, and packed cells should be given to decrease the intravascular value, which helps in preventing heart failure signs in those individuals who are acutely in need of blood supply. So, so these are the indications of blood supply, and then you have to monitor, as I told you, and then once you make a diagnosis, once you make a so you know that a patient is having anemia. If you just get away by not doing all the investigations, you may miss some of the serious diseases like gastrointestinal malignancies sometimes. That's why an elderly individual who are coming on chronic anemia, not responding well, with or without any history of passing stools in the gastrointestinal system. So you have to subject them for endoscopy, lower GI endoscopy to rule out colonic carcinomas, reticulitis, inflammatory bowel disorders, polyposis, etc. All these disorders can be made provided if you do the investigations. So, in of course, young, you may be conservative, and in such cases also, if you do, you may find maybe ulcers or ulcers maybe due to any bleeding infections like shigellosis, etc., etc., or any other infections which will produce like ascariasis. Also will produce some of the ulcers and which will so or so in such situations you have to treat anemia with all iron deficiency all measures, and then infections you should treat by giving if it is typhoid, use quinolone, ceftriaxone, and if it is due to ankylostoma duodenale or Nicator americanus, you can give Bifinium hydrochloride or mebendazole or albendazole should be given for a period of a week or 10 days. Otherwise, the worms and the ova and cysts may not die completely. And then ascariasis, you can give piperazine citrate or albendazole can be given for at least 3 to 7 days. Remember, never give one. It's not. It's a misconcept that albendazole single dose is not correct, and it should be given for at least 5 to 10 days time. And if it is amoebiasis, you treat amoebiasis with mm, metronidazole or tetracyclines, and it also should be given for 7 to 10 days. And if it is chronic, and you may even have to extend for 14 days therapy to cure the disease and till the stools clear and a stool becomes negative for ova and cyst. So this is how you should treat a patient of iron deficiency, anemia, and so I forgot to tell you in symptoms that the patient may have even pica in patients with iron deficiency, anemia with uh, worm infestations. So the pica means eating something other than the normal food, like eating mud, eating what not, or eating anything. Even some of the people dried dung also they may eat, and sometimes it happens. So I've seen people doing it also. And even people with worm infestation, so with iron deficiency, anemia, do eat like that. They eat whole and anything available. So even mostly mud or any type of food or fruits thrown out on the ground also they eat. That's called pica. Even pregnant women also sometimes they crave for eating some mud or something like that. Okay, this is how you, and so unfortunately the slides made are not opening up in the. So, okay, next time we'll take care. Okay, sorry for inconvenience. So. Escape.